I cannot get over that song by Bright Star. Willele. Oh gosh, she had almost everyone here on their feet dancing. Really cool stuff. Well, it's time for us to have a conversation on wellness this morning on Wake Up Nigeria. And for that, we have Dr. Oluwatobi Oshunkeye. She is a seasoned expert in quality healthcare delivery with over 8 years of clinical practice experience and a proven track record in healthcare management. One thing I love about her is operational efficiency and clinical governance. She's also passionate about digital and population health, and she leverages telemedicine, which is of course an innovative strategy to expand access to affordable patient-centered care in Nigeria. Now, with her expertise in healthcare management, Dr. Oshunkeye has consistently driven improvements in patient safety, regulatory compliance, and quality outcomes. She's dedicated to healthcare innovation, preventative care, and advancing public health. Dr. Oshunkeye is focused on delivering impactful solutions that enhance health outcomes and foster sustainable advancement in the healthcare industry. Really admirable. It's so good to have you in the studio again.
Yeah, good to be here again.
Awesome.
Thanks for having me.
So now, this is the month of, for women, and I know quite well that it's not surprising that you'll be talking about women's health, screening and self-care as well. So let's start from the need to get screened. What are those important tests? Now, all tests are important because they always find something. What are those ones that specifically for women are very important, and how soon and how regularly should a woman get them?
Okay, so I would say that the two most important for women will be breast and cervical screening. And I would say that from the age of 21, every woman should start to check. Even less than that, women have to start to check their health and all that. So for cervical screening, there are the tests that you have. You have the pap smear test, you have the HPV test that should be done. So depending on your age and depending on your risk factors, you'll be told how regularly to do this screening and depending on the test results. So for example, you do your HPV screening and then they see some tests. You might be told to go for your pap smear test earlier than you would expect. Okay. So depending on what your doctors see. So that's why I say that there's no one size fits all for everybody. Depending on your family risk factors, depending on your age, depending on other tests that you've done, your doctors will tell you how regularly to do this screening. But it's very important to do this screening because for cervical cancer, for example, some results might come in from your HPV or from your pap smear. And when they intervene, it might not even get to cancer. It might just be some changes that can be treated and then it doesn't get to cervical cancer. So it's very important. And then for breast screening, you have to do your self-breast examination, very important. And then also mammogram. So usually we'll say that from the age of 40. But I tell people that depending on your family history and then depending on whatever is seen on your breast examination, you might have to go in for your mammogram earlier. So there's no one size fits all when it comes to women's health. Be close to your doctors, go for your regular checkups, and then they will let you know, oh, you need to do this test already. We don't have to wait till 45 to do this. There's also colorectal screening. People say from age 45, but if you do a stool examination and they see some changes, they might tell you, oh, go in for your colorectal screening now. So that's why I say that it's very important to talk to your doctors, and then they will, based on the history they get from you, your family history, and other factors, they'll tell you, oh, you need to go for this screening earlier than expected.
Let's talk about those self-care tips you made reference to. What are those self-care tips that could actually help women prevent some of these things?
Yes, so I would say that we need to, very important diets. Balanced diets cannot be overemphasized. So include a lot more lean proteins, you do your fruits, vegetables, all of that. And then I would say supplements. So as women, we can't just ignore supplements. So one of the supplements that I usually advise would be the evening primrose oil, very important. And then omega-3 fatty acids. So sometimes we say, oh, you can have it in your meals, but we all know where we live, the climate that we live in. You can't get all of this in your diet. So supplements, very important. And when you speak with your doctors, they will see other supplements that are good for you. So I tell people, don't just go and they say, oh, they're taking supplements, and then you just pack everything. You might be doing so much. So please see your doctors, and then they will tell you which one
to your own
for your own needs. Very important. Then also exercising. You can't overemphasize that. So it doesn't have to be high energy exercises like strength training and all that. It can be yoga, it can be swimming, taking a walk around, but make sure that every day you're clocking in some form of exercise or the other. Very important. Then sleep too.
Okay.
You can't do without that. At least 5 to 7 hours, 7 to 9 hours, some people will say, of sleep. Very important. Because as a woman, you need your hormone to be balanced. And sleep is one of those factors that can help. So very important. Of course, we're living in very stressful city like Lagos, but we need to find in time to clock in that number of hours. Very important.
The hormones you mentioned now brought me to this question. Hormonal changes are also responsible for certain factors and certain issues that women have. How do you manage and balance them?
Yeah, so for hormonal changes at different points, when you start at puberty, at menopause, you have all of that. And that's why I mentioned these other tips earlier. Exercise is one of the ways that you can put your hormones in check. Very important. Sleep. Then another thing I'll also say is also to avoid hormonal disruptors. So like plastics. In plastic, you have all these endocrine disruptors and all these plastics and all. So you need to limit what you're eating from plastic bowls. Then some people like to microwave in plastic bowls. You need to avoid that. Or you put a can of water in your car and it's been in the sun all day. You get into your car, you want to drink from that bottle. Very important. So you need to look for things that don't throw your hormone off balance. But even when you can't, for example, menopause, you can't avoid. Puberty, you can't avoid. But what you can do is your self-care tips. Those will help you. You increase your exercises, take supplements as you need, rest well. Those tips would help with the hormones. But when you find out that you've done all that you can naturally and you still have this hormonal imbalance, it's the best time to see your doctor. Very important.
So you mentioned self-care tips earlier. Now, for some women, because of raising their family, taking care of their responsibilities, and of course then many women work now, managing their businesses and all, there's that guilt that comes with, self-care. How can women give themselves that necessary self-care without feeling guilty?
Yes, so one of the things I always say is you can't pour from an empty cup. I say it all the time. And so I like to tell women that don't see self-care as something that you are doing that is not good. It's something that you are doing so that you can function better. I think that once you have that mindset shift, then it's easier to do it without feeling guilt. Because you know that if you don't prioritize your self-care, how do you give your family your best? So I feel like if you put it in your calendar, the way you put your work meetings in your calendar, the way you put your childcare in your calendar, you also put self-care in your calendar. I feel like at a point it becomes something that you're also doing alongside your other chores, and then it doesn't become overburdening, and then you don't feel guilty. So it's the same way you're going to say, I've picked up my child from school, and you tick that. It's the same way you say, I've gone to the spa, I've ticked that. I've slept well, I tick that. So I think that we should put it in our mind as something that I need to do so that I can give my best at work, for my family and other things.
It's a good thing you mentioned the spa, because many women wonder, I don't have so much time to spend at the spa. I don't have a lot to do there. What are those specific medical aiding, treatments that one can get at the spa? Like maybe a massage, or what exactly are those things that women should look out for? So
I'd say that it's according to your needs. So if, for example, I work in an high-paced environment and I'm having body pains all the time, getting a massage is a good thing to do. Or I say that, I'm not present at all times. If you do meditation, you practice mindfulness, that's the self-care that you need at that time. I'm not getting enough sleep all week and all that. If you block out a weekend to sleep better, that's self-care at that time. So I feel like when we say self-care, a lot of people think, I have to go to the spa, I have to go do my nails. It doesn't have to be that. It depends on what your needs are at the time. So if you've had a rough week and you just want to sleep in that weekend, that's self-care that weekend for you. If, I have body pains, I need a massage, or I'd like to do my facials, that's self-care for you that weekend. And some other weekend, it might just be, I just want to do yoga, or I just want to go swimming. So whatever self-care is for you at that time. And so that's why I feel like self-care is not just a buzzword. It's you looking at yourself part time and be true to yourself. What do I need at this time? Sometimes it might just be somebody take the kids away and let me have my peace.
For how long?
It might be for a few hours. So, a day, whatever works for you. That's what I'm saying. You're looking for someone that'll take your kids for how long? Way more.
Like 2 months.
You can have that.
I didn't say that.
But you will miss them. That's the thing.
Of course.
Exactly. So I think that as women, it might even be the kids are there, but but there's something engaging them, and then you can have your 1-2 hours to do your own work without that disturbance. It might just be childcare, whatever it is for you. I feel like let's not get in the buzzword self-care, and think that it's something that would cost money, would cost time. Sometimes it might just be you in your bedroom, watching a video or sleeping in.
This is the month for women, and we've been able to touch on quite a number of needs that women have. Now, as a medical doctor, what counsel would you give an average woman watching you right now?
Yeah, I'll tell every woman watching me right now is get close to your doctor, sit with them, have an assessment, and let them look at you and tell you, okay, these are what your needs are. Screening, very important. So it's not just breast cancer, it's not just cervical cancer, it's not just colorectal cancer like I mentioned. There are a couple of other screening, thyroid, diabetes, hypertension, you know. Just sit with your doctors, have an assessment, give yourself that regular checkup. I tell any woman looking at me today, say that if you have not done your annual check, Women's Month, February is a good time to go see your doctor, have an annual check, let them go through all your vitals, go through everything, and then they will advise you based on the result that they see. And then I also say that please take self-care very important. It's not necessarily go to the spa. It might just be sleep better, it might be eat better. Exercise also very important. At any age that you are as a woman, I think it's time to take exercise very seriously. It doesn't have to be high energy. It can be walking regularly. Just be consistent. That's what I always say. If it's yoga, do it. If it's walking, if it's swimming, whatever it is. And then pick up a hobby. Very important. I think that when we do something that makes us happy, we're just better. And then find a very supportive community. Whether at work, whether at church, wherever it is, mosque, wherever, just find a community that likes you, pours into you, and then you're also pouring into them. I think that all that activity kind of gives us energy and makes us better women.
Nice, nice. So you're watching us now and you've learned a few things you need to know to be better, especially when it comes to your self-care and being at your best. Dr. Oshunkeye, thank you so much for your time.
Thanks for having me.